Welcome to the Human 5.0 Project, the podcast where we cut straight to the breakthroughs that matter, the show where science meets self-optimization. I'm your host, UltimateBiohacker 10X, and here we break down the real research, real data, and real dosing behind modern biohacking, from compounds and peptides to techniques, devices, lifestyle strategies, and performance protocols. Most people jump in and jump out before they get the gold, so we're keeping it tight and delivering the essential insights you need without the fluff. If you've taken the time to hit play, we'll make sure you walk away with valuable knowledge that can transform your approach to longevity, health optimization, and beyond. You know the moment, that sudden pop, the tearing sensation, immediate denial. It's fine, I can walk it off. Then the MRI verdict. Complete tear, 6 to 12 weeks. Muscle atrophy begins in days. You're sidelined. You're watching your hard work dissolve while you ice and ibuprofen your way through Netflix. But in 2026, the conversation around healing has fundamentally changed. We're talking about peptides, BPC-157, TB-500, IGF-1 LR3, and PEG-MGF. These compounds promise to hack the healing cascade. Angiogenesis, cell migration, collagen synthesis, satellite cell activation. The internet calls it Wolverine mode. But here's the mandatory reality check. These are research compounds still. They're not FDA approved for human use or injury treatment. The evidence is preclinical, strong in animals, but weak in humans. Mostly small studies or anecdotes. The World Anti-Doping Agency, they've banned them all. The FDA has placed restrictions on their compounding. Anecdotes are compelling, but anecdotes are not randomized controlled trials. Just a quick disclaimer here. This episode is for educational purposes only. It's not medical advice. I am a doctor, but I'm not your doctor. Consult a licensed physician. Get baseline blood work. Prioritize proper diagnosis and structured rehab. And if you explore further, sourcing must be verified with a third-party certificate of analysis confirming greater than 98% purity. This is Ultimate Biohacker 10X. Let's dissect the biology, stack intelligently, and separate the powerful signals from the noise. Let's engineer healing and lock this one in. To understand why these peptides are interesting, we need to look at the injury cascade. It's got 3 phases. Inflammation, and this is the cleanup crew coming in, clearing out damaged cells. Proliferation, where the body builds new tissue, collagen for tendons, protein for muscle. And then remodeling. The new tissue actually strengthens and organizes itself along lines of stress. Tendons and muscles heal slowly. Tendons have poor blood flow. Muscles are prone to atrophy. Body's natural signaling is designed for survival, not peak performance optimization. So, what are peptides? Well, they're short chains of amino acids, and they act as precision signaling molecules. They don't build tissue directly, but they tell your body to do it better. Think of them as upregulating the pathways your body already uses. So here's our 2026 lineup. BPC-157. This is the master of angiogenesis and collagen organization. It's a tendon specialist. TB-500, this is the systemic recruiter. Think of it as managing your cell migration and inflammation. IGF-1 LR3, this is a potent driver of protein synthesis and satellite cell proliferation, hence muscle building. And then pegylated MGF. This is a localized satellite cell activator, and it's focused on regeneration after stress. Golden rule here, peptides amplify signals. They don't replace mechanical loading, sleep, nutrition, or time. Rehab is king. Peptides are potential support. First up, BPC-157. This is a synthetic peptide derived from a protein in human gastric juice. Yep, your stomach. In preclinical models, it's a star. Rodent studies show faster healing of Achilles and MCL tears with better collagen fiber organization. It boosts VEGF for new blood vessel formation, and it stimulates fibroblast migration. Human evidence? It's thin. One small retrospective series on knee injections showed subjective pain relief in about 7 out of 12 patients, but there isn't a large randomized human trial for tendon or muscle injuries. The evidence gap is enormous. Let's spec this one out. Half-life, short, 4 to 6 hours. Dose, anecdotal range, 250 to 500 micrograms a day. It can be split into a couple doses. Subcutaneous injection near the injury site is preferred for local effect, although systemic injections work. And for those of you who don't know what that means, systemic would be injecting it in the abdomen, but it works on the knee. Cycling, typically 4 to 8 weeks. Oral forms are considered poor for musculoskeletal issues. And yeah, you'll hear that BPC-157 orally is used for gut repair, and we've done an episode on that. As far as hype versus reality, BPC-157 speeds up quality healing in animals, and human anecdotes are promising but unproven. It's not anabolic. Its focus is repair and not growth. All right, next up, TB-500. This is a synthetic fragment of thymosin beta-4, or TB4, which is a protein involved in cell structure. Its main job is regulating actin, a protein that allows cells to crawl and migrate. It also modulates inflammation and promotes angiogenesis. Now, animal studies show it improves healing in tendons, muscles, and wounds, and it can reduce adhesion formation, which is scar tissue binding structures together. Human evidence? Well, TB-500 has been in phase 1 and 2 safety trials for wounds, eye tissues, and heart repair. But for tendon recovery, again, no robust randomized controlled trials. So let's spec this one out. Half-life, longer than BPC, around 4 to 6 days, making it more systemic. Dose, anecdotally, 2.5 to 5 milligrams a week, split into a couple of subcutaneous injections anywhere in the body. Cycles will often run 4 to 6 weeks. Now, this is where the famous synergy comes in. TB-500 recruits cells to the area, BPC-157 directs them to build. This combo forms the Wolverine base in biohacker communities, or the Wolverine stack, as you've probably heard. All right, Mythbuster here. TB-500 is not a steroid. It is a signaling peptide. So there's your core stack, BPC-157 and TB-500. They work synergistically. It's the foundational protocol for most soft tissue injuries based on anecdotal and community reporting. A weekly research use example might be BPC-157, 250 to 500 micrograms twice a day, subcutaneously near the injury, and TB-500, 2.5 to 5 milligrams twice a week, subcutaneously systemic. For a phased approach, phase 1, which would be acute weeks 1 to 2, we would focus on BPC and TB. You might load TB higher in week 1 and prioritize rest and gentle range of motion, no heavy loading. Phase 2, weeks 3 to 6, maintain the peptide protocol, and this is when you aggressively introduce rehab. First isometrics, then controlled eccentrics. The peptides create the environment, and the rehab builds the structure. Injection tips, always sterile, rotate the sites for TB-500. For BPC-157, anecdotal evidence favors injection as close to the injury site as possible. What do people report? Anecdotally, a 30 to 50% faster return to baseline. But is this the peptide, the rehab, or the powerful placebo effect? Without placebo-controlled human trials, we simply just don't know. Now let's jump to growth. For those focused on muscle preservation or hypertrophy during recovery, we add another layer. IGF-1 LR3. This is a long-acting analog of insulin-like growth factor 1, with a half-life of 20 to 30 hours. It drives muscle hypertrophy, satellite cell fusion into muscle fibers, and collagen synthesis. Animal and in vitro models strongly support its role in muscle regeneration. Human data? IGF-1 analogs show protein synthesis boosts, but there are no direct injury randomized controlled trials for the LR3 variant. Dosing? Anecdotally 40 to 80 micrograms per day, post-workout or post-rehab, IM or subcutaneous. Now, there is a risk here because you could cause hypoglycemia, and you really want to avoid it if you've got a personal or family history of cancer because it is unproven as to whether or not it promotes cell growth in tumors. Next up is pegylated MGF, and this is the pegylated version of mechanical growth factor, a splice variant of IGF-1. Pegylation makes it last longer. Its role is to activate satellite cells specifically in response to mechanical stress or damage. Animal studies show improved muscle repair, but human data is mechanistic only, and there are no strong clinical trials here either. Dosing? Anecdotally, 200 to 400 micrograms 2 to 3 times a week injected IM into the target muscle group. And how would we stack this? Well, this is definitely an add-on layer, typically introduced in phase 2, where you're doing repair, and this would be like weeks 3+. And this is after the BPC-TB foundation has been laid. And you use it when you're actively loading the muscle to help preserve mass or even support new growth. Hype versus reality? These are powerful pathways with strong mechanistic potential, but the human proof for injury recovery is very limited. And these are not casual tools. Next, we're going to jump to full phase protocol. Now, this must be physician supervised. Get comprehensive blood work before, during, and after. Okay? The 2026 protocol framework for research only. Phase 1, acute, weeks 1 to 2. BPC-157 and TB-500. Our focus is inflammation control, rest, and nutrition surplus. Phase 2, repair, weeks 3 to 6. BPC and TB, and optionally IGF-1 LR3 or pegylated MGF. Our focus here, progressive mechanical loading, isometrics and eccentrics. Phase 3, remodeling, week 7+. We taper off the peptides. Our focus is sport-specific loading and return to activity. For maintenance, we want to cycle off of these for an equal time period that we were on them and just prioritize the basics. Non-negotiable support system here. Nutrition, protein at 1.6 to 2.2 grams per kilogram of body weight. Add 10 to 15 grams of collagen with vitamin C pre-workout. Sleep, 7 to 9 hours. This is when your natural growth hormone peaks and repair happens. Micronutrients, zinc, vitamin D, magnesium, omega-3s. These are all critical for the enzyme functions involved in healing. Loading strategy, you must progress from isometrics, which is no joint movement, to eccentrics, lengthening under load, to full concentric strength. Remember, peptides enhance the signal. A bad rehab protocol will nullify everything that you do with these. So that's a lot of information. Now we got to figure out hype versus reality, risks, legality, all of this stuff. So let's cut through the noise here. The hype, overnight miracles, skipping physical therapy, building muscle while sitting on the couch. Just doesn't happen. The reality here in 2026, preclinical data is promising, human data is sparse, most reported side effects are mild, injection site reactions, temporary fatigue, occasional GI upset with BPC, and blood sugar changes with IGF-1. Rare but serious risks include infection from poor hygiene and potential immune modulation. The long-term risks of exogenous peptide use are completely unknown. Legality? According to the FDA, these are not approved for this use. Recent Category 2 restrictions make compounding for anti-aging or injury much harder. Regarding WADA, all are prohibited. BPC-157 and TB-500 are on the S0, which is non-approved substances list. IGF-1 is on the S2, peptide hormones, so athletes beware. Sourcing reality. Now this is a gray market. The risks of impurities, incorrect dosing, or even harmful substitutes are real. So this is mandatory. You must see a third-party COA. This is called a certificate of analysis, and it needs to come from a reputable lab that does HPLC or MS testing, and they need to confirm greater than 98% purity and sterility. For reconstitution, use bacteriostatic water. This is different than normal saline or sterile water because it has alcohol which prevents the proliferation of bacteria. Okay? Be gentle. Peptides are fragile. So don't shake the bottles, just rotate them gently until it's dissolved. Red flags? Extremely cheap prices. No COA available. Or somebody promising medical miracles. And I could probably take it a step further. If you're buying it out of somebody's closet, it's probably not something you want to purchase. But I hope you already know that. When we look at healing, the horizon is interesting. Copper peptides like GHK copper, targeted delivery systems, and even personalized genetic protocols to see who might respond best. It's all there. But the bottom line for 2026 hasn't changed. Your biology wants to heal. Peptides are experimental tools that may help optimize those signals, if and when the evidence finally catches up to the anecdotes. Until then, your protocol must be rehab first, physician supervised, and evidence-based. Remember the 4 pillars. Signal with BPC and TB. Build cautiously with IGF-1 LR3. Regenerate with PEG-MGF. Support relentlessly with nutrition, sleep, and smart loading. Share your recovery journey or your questions with me on X at UltimateBiohacker10X or follow me on Instagram. For the detailed phase-based protocol PDF with heavy disclaimers and a sourcing checklist, download the addendum at the link in our description. Stay adaptive, stay evidence-driven, and stay structurally stronger. This is Ultimate Biohacker 10X, and I'm out. Thanks for listening to the Human 5.0 Project. If you found value in today's episode, share it with someone who's ready to elevate their biology. Make sure to follow the show for weekly deep dives into peptides, protocols, devices, lifestyle strategies, and the science of high-performance longevity. Until next time, stay curious, stay optimized, and stay 10X.